Diabetes is something that we, meaning humans, have known about for a very long time. As far back as we have any recorded writing, there are descriptions of people that had diabetes. And usually the description was that they had wasted away and died.
We know that insulin is key for lowering blood sugar. It is a signaling molecule that acts on certain cells in our body to take up glucose and use it. In type 1 diabetes, there's complete absence of insulin, but there's plenty of glucose in the blood. In fact, there's too much glucose in the blood. Many people call it the disease of starvation in the setting of excess.
A group in Canada in 1921 actually for the first time showed that they could make an extract from the pancreas and inject that into a patient with diabetes and bring the blood sugar down.
You can see those children that developed diabetes at the time of the discovery and were wasting away. Pictures before and after they received insulin are incredibly dramatic.
At UCSF in the 1950s, Peter Forsham developed a group of investigators in the metabolic unit with an interest in hormone function and in diabetes. He recruited a new young faculty member at the time named Jerry Grodsky. Jerry Grodsky developed one of the first methods for measuring insulin in the blood. In 1980, Dr. Bill Rutter was the first to clone the insulin gene. It gave us a method for producing human insulin in the laboratory rather than purifying it from animals.
Today, because of that discovery in part, all the insulin that is given to anybody in the world is insulin that's made in bacteria.
I arrived in a diabetes center in summer of 2000. I was a postdoc at University of Chicago with Jeff Bluestone. And then he announced that he was going to come to UCSF to be the inaugural director of the UCSF Diabetes Center.
Jeff Bluestone helped champion a drug that we call Teplizumab, which is basically a monoclonal antibody which binds to a component of the T cell receptor. T cells are a very important part of our immune system in protecting us from viruses and infections, but they also tend to be the directors of autoimmune disease. Some T cells make a mistake and start attacking the pancreas. A pivotal trial showed that we could delay diabetes by at least 3 years on average in patients, and there were some patients that was delayed more than a decade. And that led to FDA approval of this immune therapy, which is a very exciting result. It's the first immune therapy to ever be approved for type 1 diabetes and came out of work in this very department.
My research very quickly after I arrived in the diabetes center started to shift. We managed to grow regulatory T cells in the lab. At that time, it was a very difficult task. It didn't have a lot of cells, and I didn't want to throw them away. I didn't know what to do with them. These mice are going to get diabetes in about 2 weeks, and then I might as well just inject these cells into the mice and see what happened. In 2 weeks, they didn't develop diabetes, and next week didn't come. Next week didn't come. The very 3 mice that I injected the cells in never ever developed diabetes. When you have data like that, you just have to follow that and then see how does it work, and then can this work in humans?
What's so exciting about the diabetes center is we have teams and they're working together, working on engineering the beta cells so that they have a better dialogue with the immune system. And then meanwhile, our lab and the other immunologists are working on how can we engineer T cells and immune cells to go in and create an environment so they don't get killed again.
I came here in 1983 as an endocrinology fellow, and I joined Bill Rutter's group. Things were moving very fast. We cloned many of the genes that are involved in producing insulin in the beta cell. I've often wondered what it is about UCSF that made this possible, and a lot of it is the people at UCSF. There was this sense that you could ask tough questions. You didn't have to just do what everybody else did. You could try completely new and different things, going for the most fundamental and most important question that you could. That's where the success comes from, I think.